Hello, and welcome to D439 Foundations of Nursing. My name is Kelly Schmidt, and today we will be going over Chapter 15, Critical Thinking. The ability to think critically is a necessary component of clinical decision-making in nursing. Critical thinking is essential to the provision of safe and effective nursing care. Critical thinking is a learned cognitive skill that requires an analytic thought process and will continue to evolve and improve over time, especially in your role as a nurse. In nursing, effective critical thinking leads to positive patient outcomes and improvement in the accuracy of clinical decisions. Critical thinking is a way to improve the actual process through which decisions are made and conclusions are reached. Truly understanding the complex thought process of critical thinking requires an understanding of how an individual arrives at a conclusion when presented with a problem or issue. Critical thinking improves the quality of an individual's thinking by purposefully applying the structures inherent in thinking and imposing intellectual standards on them. Critical thinking includes the application of the scientific method. The scientific method is a series of 5 steps. This is designed to initiate a deeper level of thinking. It seeks the truth by confirming that the facts are in agreement with reality. Everyone is a thinker. Critical thinking is a specific focused effort as opposed to thinking which occurs subconsciously. For example, driving to work along the same route every day without thought to which way to turn is an example of subconscious thinking that occurs in our everyday lives. However, what if you wake up one morning and you hear on the radio or the TV that a major accident has stopped all lanes of traffic under a normal route to work? You would have to think critically about the best way to commute to work, evaluating whether distance or time is more important in your new route. Which route should have less traffic or fewer stoplights? Should you consider how many other drivers will also be rerouting their normal drives to work? Critical thinkers have the ability to focus on problems and produce effective and creative solutions. The term critical embodies the creativity and awareness the individual must apply to their thought to arrive at the best conclusion. The ideal critical thinker is inclined to reach the right decision by seeking to be well informed, remaining open to ideas of others, and avoiding confusion or intimidating others and their beliefs. Some things we need to think about. What are our own limitations and biases? Do we come excited with new challenges? Do we seek clarity and understand the end result? Are we receptive of others' ideas? Do we use credible sources? Are we impulsive in reaching a conclusion? Do we avoid involving emotions in the final thought process? Are we active listeners and are we open-minded? Critical thinking is the conscious decision to not accept a thought or an idea at face value and instead attempt to fully evaluate it from different perspectives. Perhaps the best way to describe critical thinking is a checklist. Here's an example. A friend of yours is trying to decide whether she would like to try the latest diet craze. Instead of just saying yes or no, your friend decides to think critically about the pros and cons of following this strict diet. First, your friend should understand her own reasoning for trying this diet. Is your friend looking for better nutrition, more energy, or weight loss? Maybe she is interested in all three aspects, but regardless, it is important that she gather more information about the diet. She can ask nutrition experts for their opinions. She can research nutrition websites, and she may even ask a coworker who has been on that diet for a few weeks about how she's feeling. After seeking more information and clarifying facts, your friend can then apply the information to her rationale for trying this diet. From the information she has gathered, your friend will consider whether she wants to have more energy or just promote weight loss. Maybe your friend needs to consider certain implications of this diet. For example, how much will this cost with the specific foods are required? Perhaps she has learned that this diet may not be a good option because the family has high cholesterol. After exploring others' points of views and evaluating her own choices and reasons, your friend can then make an educational decision about whether to make these dietary changes. One of the most followed frameworks for critical thinking was developed by philosophers Richard Paul and Linda Elder. They believed critical thinking is self-directed, self-disciplined, self-monitored, and self-corrective thinking. The critical thinker has three components: intellectual standards, elements of reasoning and thought process, and intellectual traits. According to Paul and Elder, the following intellectual standards are required to be an effective critical thinker. Questions asked by an effective critical thinker have been thoroughly vetted by the thinker using the following standards: clarity, accuracy, relevance, logic, precision, fairness, etc., etc. Here are a few with their definitions. For example, accuracy. Can it be proven correct, and can it be tested or confirmed? Logic. Does the answer make sense, and is the answer consistent? Clarity. Are you able to elaborate, and can you describe it in a different manner? Are all the viewpoints represented, and do I have bias that needs to be addressed? Are there complexities that need to be addressed related to the problem or issue? Everyone thinks, but often our thoughts contain bias or preconceived prejudice and can often be a result of misinformation. The elements of thought, according to Paul and Elder, describe the actual reasoning process that occurs while thinking critically. All thinking is influenced by 8 elements that comprise the thought process: purpose, question, point of view, information, inference, concepts, implications, and assumptions need to be clearly identified and understood to develop the intellectual traits seen in a critical thinker. Our thoughts and our reasoning should have a purpose, and they should be clear. It should be concise and justifiable. We should be open to the perspectives of other people's points of view. The information we present should be accurate and relevant. The information also should not come from an opinion or an assumption. Do we know what could happen if there are consequences. Some traits that we should consider are on the screen. Do we have the courage and the ability and willingness to challenge what you thought was correct and come to another conclusion when necessary? Do you have empathy, the ability to put yourself in someone's shoes and generally understand their positions and beliefs? Do we have autonomy, the ability to take responsibility for your own thinking and actions, along with not conforming to the beliefs of others? Do we have perseverance, the ability to continue to focus on desired results despite frustrations and limitations that come up along the way? I'll leave some key points up on the screen. Feel free to stretch your legs, grab a snack. I will pause for a few moments. Critical thinking is a multi-dimensional process that encompasses feelings, past experiences, and individual perceptions and biases. It is a necessary component for providing safe and effective patient care. A nurse who is proficient in thinking critically is confident, safe, independent, and ultimately has better patient outcomes and usually increased job satisfaction. In the nursing profession, the practice of nursing also requires clinical reasoning. Clinical reasoning and clinical thinking have been viewed as interchangeable items. Clinical reasoning is the specific thought process used in nursing when analyzing, evaluating, assessing, and managing a patient in a specific setting, such as the bedside or a hospital. When discussing reasoning about other clinical issues, such as nursing management or leadership, critical thinking is the more common terminology. Factors that can affect critical thinking are age. Moral development evolves over time. Older adults have had more experience and opportunities to see things from a different perspective. Low self-confidence can also limit critical thinking because the thoughts of those individuals are often focused on concern for failure or being wrong instead of for developing productive solutions. High self-confidence also has the ability to limit critical thinking because it can hinder open-mindedness. Someone with high confidence must think their ideas and solutions are best. Individuals' current likes, dislikes, biases, and prejudice may also be open and on the forefront. Being able to communicate well is also an important necessary requirement for critical thinking. An effective writer and speaker can organize thoughts clearly and present them in ways that are easy for others to understand. At the start of our nursing career, Newly graduated nurses are novice thinkers who lack the professional experience to feel confident in their clinical making decisions. It takes time and experience to transition from the novice nurse to the expert nurse. Researcher Patricia Benner categorized the stages of thinking in the nursing career: novice, advanced beginner, competent, proficient, and the expert. Novice nurses are beginners who lack experience or experienced nurses in a new clinical situation. Skills are learned by repetition. An advanced beginner is a nurse with limited nursing experience, less than 2 years, who has demonstrated the ability to provide safe patient care in real clinical situations. These nurses start to make some clinical judgments based on their experience. Competent nurses have more than 2 to 3 years experience in the same clinical setting, such as if you are working in the emergency room or labor and delivery for an extended period of time. Competent nurses can understand long-term goals and have mastered most nursing skills. Although for a side note, um, when I was teaching clinical several years ago, I definitely ran into something that I had never seen before. If anyone is interested in my moment of not feeling competent after 15 years experience, reach out and I'll share that with you. A proficient nurse has at least 3 years experience. They can foresee and understand all viewpoints and possibilities associated with certain scenarios. The nurses can view the entire situation instead of just isolated parts. A proficient nurse may start creating patient assignments and functioning in the charge nurse role. The expert nurse has many years of experience and is capable of recognizing the possible demise of a patient based on clinical symptoms and past experiences in patient care. Nursing decisions are often based on intuition, and decisions are made instantaneously. The expert nurse can be charge nurse, preceptor, mentor, or manager. The nursing process is a series of organized steps designed to help nurses think critically throughout their nursing career. Assess, analyze, and diagnose, plan, implement, and evaluate. This was developed to encourage critical thinking in nursing and is based in part of the critical thinking framework created by Paul and Elder. The process includes assessing the problem, the concern, the issue, then analyzing and diagnosing the facts, then develop a plan to address the problem or concern, implement the plan, and evaluate the outcome. Although many nursing decisions are based on habit and do not require in-depth reasoning, sometimes higher thinking skills are required to make a decision that is beyond routine. After the process of thinking critically, the nurse must decide on a course of action by making decisions about what is best, especially when more than one course of action is available. When faced with multiple needs of one patient or multiple needs of multiple patients, the nurse prioritizes the need to determine which to address first. They will then examine the pros and cons of each option and determine which needs can be delegated to others and follow through on the decided course of action. Critical thinking in nursing practice requires problem-solving skills, the ability to recognize when to act early, and discerning between what problems, needs, concerns, or issues need to be addressed first. Critical thinking, once again, improves with time, experience, and practice. Unfortunately, in the nursing profession, barriers exist that can make critical thinking more difficult. These barriers include shorter length of stays, more acutely ill patients, and increased patient-to-nurse ratios. Therefore, it is imperative in your nursing career to start early, practicing the skills that can best promote the process of thinking critically. How can we promote critical thinking? There are many activities that all nurses can do. From newly graduated nurses to those with years of experience can implement to promote critical thinking. How about you engage in frequent planned interactions with your colleagues? This can be informal, having coffee before or after work, or formal, regularly scheduled staff meetings. This can be a great way to learn from more experienced nurses in the profession. Asking how another nurse would have handled a specific situation can open the novice nurse's eyes to a new perspective and a new way of handling a situation. Hearing different points of view and constructive criticism provides critical thinking skills and offers a valuable opportunity to engage in the critical thinking process. As long as a patient's identity is protected, how about reflective journaling? This is a great way to learn from experience and gain critical thinking reflection or skills. Reflect with positive patient experiences. Reflect on experiences where knowledge was gained from an experience that went wrong as well. You can record these and read them at a later date and time. You can ask yourself such questions as, what did I learn from this experience? How could I have handled the situation differently? Or what were the consequences of my actions? This process will work well with all patient encounters and even interactions with colleagues. Clearly communicating your thoughts in addition to asking others for clarification on others' thoughts or beliefs helps promote two-way conversation. This is necessary for open communication and the promotion of critical thinking. We should make sure that we're present in the moment and engage in open-ended questions to elicit more information and be courteous and respectful of others' opinions. There are barriers to critical thinking. It is important not to select any hypothesis until after all the facts and information have been gathered. It is important that we stay away from bias. We should stay away from preconceived hypotheses that were already formed as a thought, and we should not ignore the evidence that is against it or competing. We shouldn't have tunnel thinking, having an expectation of a result, but instead of hand-picking the evidence to be seen as used, the thinker has a preconceived or tunnel notion. This is even before the event occurs. And jumping too quickly to conclusions or not clearly thinking through the presented information can limit critical thinking and dissuade options or solutions that could have provided a positive result. We need to gather all available information before reaching a conclusion. Attempting to reach a conclusion without all of the necessary information could hinder or change the outcome. Instead of assuming the patient might be tachycardic due to dehydration, we should probably obtain a chest x-ray to gather more information. This may show an enlarged heart. This would prevent us from giving a fluid bolus if they were dehydrated, which could be detrimental to the enlarged heart. We should also not be resistant to change and not open to new ideas. This can be an overwhelming barrier to critical thinking. For example, a nurse who does not learn the new correct way to perform a procedure because he or she has always done it this way. Good communication skills are essential in nursing, not only for increased patient safety, but for the enhancement of critical thinking among nurses and your healthcare providers and colleagues. Many specialized procedure guidelines and communication tools have been created to promote patient safety and eliminate or minimize errors that reach the patient. SBAR is a widely used communication tool in healthcare settings and frequently used during the transfer of a patient from one nurse to another, or whether it's from one unit to another, or the transfer of a patient between nurses working on the same unit. SBAR is also used for change of shift reports from one nurse to another and on interprofessional rounds with other healthcare providers. Daily patient rounds, which include all disciplines involved in the patient's healthcare, can facilitate effective communication in many categories, such as mobility, nutrition, procedures, skincare, infection preventions, or pain management. With interprofessional daily rounds, instead of healthcare provider-led rounds, each discipline can communicate critical contents and concerns regarding the patient's health status. This is open communication that encourages critical thinking among all healthcare providers by addressing concerns and gathering necessary information from different perspectives instead of just through one viewpoint. Some additional steps we can take. We can understand and identify your own assumptions and biases. We can make mutual communication a priority. Remember to use references that have been vetted or are based on evidence, no opinions or assumptions. Make critical thinking skills a priority. And even ask for an evaluation of your critical thinking skills in areas where you could improve. The top reasons for adverse patient outcomes can usually be attributed to failure to properly analyze the patient or situation. It can be failure to enact the appropriate treatment of plan and failure to initiate the correct response. Nurses must have sound knowledge bases, experience, technical expertise, and astute clinical judgment. We also need to develop, encourage, and practice the 5 rights. This can help us reinforce and improve a nurse's critical thinking. Effective critical thinking helps identify at-risk patients and involves the quality and safety of the nursing care provided. We should look for the right cue. We should recognize the detail in the available patient information that is most important. We check the right patient to prioritize which patient to see. This is the patient who has the most critical need. Right time. Let's identify which patient needs to be tended to first and carry out the necessary tasks at the appropriate time. Right action. Which part of the task is most important and who should carry out the task? Can you delegate? And what is the right reason behind the action or behavior? Is it ethical, legal, and professional? I'll leave the summary up for a moment, and as you know, please reach out with any questions that you may have. I hope that you have a great rest of your day or evening, and thank you again for joining me.